Hello. So this is Hello everyone. This is the NEET PG 2025 Live Doubt session. So you can ask your doubts in the chat box. Okay. Uh, Dr. Ambivert have asked that last 20 days में क्या करें to get under 40k. Why you are expecting means under 40k? Just expect under 1k or 2k. Okay, then you will get MD radio, medicine, surgery, ortho, anything you can get then. So in last 20 days strategy, I have posted a video on the my YouTube channel in which I have told that do maximum to maximum MCQs of the grand test. Okay, marrow grand test are very good and do maximum MCQs of grand test. So do means review the grand test. Sorry for the technical issue. So in last 20 days, just do maximum grand test, review maximum grand test. That is the strategy. And doing maximum grand test will take time. Means if you review one grand test, it will take over 3 to 4 hours. And if you whole day will go into reviewing 2 or 3 grand tests. So that's why we have simplified the thing in our book and just review the book. It contains 20,000 MCQs and the one line explanation of every question. So you can go and see the book video, and if you want to review yourself the marrow grand test, you can review. Any doubts you can ask in the chat box. So if you are having any doubt, you can ask in the chat box. We will try to answer it. Any doubt related NEET PG 2025, whether academic or related to the preparation, write in the chat box. Okay, let me tell you some questions. So, uh, best method to detect the HbA1c is ion exchange chromatography. Then, next important question is this inclusion of diuretic is necessary for diagnosis of resistant hypertension. Means if you are making a diagnosis of resistant hypertension, then one of the drugs should be necessarily the diuretic. Okay, Akshata Nayak is asking, is PDF handwritten or printed? At this time we are providing the handwritten PDF, and it contains 600 pages, and so we didn't have that much time for to get it typed now, but later, a few months later, we will try to get it typed. Okay, but now it is handwritten. So I have made some diagrams also to identify the radiology images and how to identify them easily. So the radiology image which came of neurocysticercosis, it was in my this book. uh, I made dot inside them, so I remembered that Scolex will be there. So in Iniset exactly that was asked. Then aluminum phosphide poisoning question, uh, positive silver nitrate test, so that was in the book. And I wrote this Iniset to November 24 questions. So three questions were asked from there. So this refeeding syndrome question was also there. Okay, so we don't know what question can come back from the previous years and from the grand test. Okay, then it's covering 20,000 MCQs. Okay, so continuing our session. So male pelvis have large acetabulum, female pelvis have triangular obturator foramen, U-shaped pubic angle. So female pelvis have U-shaped pubic angle and everted ischial tuberosity. Everted ischial tuberosity. Then social smile occurs at 1 to 2 months of age. Pincer grasp at 9 to 12 months. Then waves bye-bye at 9 months. Okay, the next is yeah, the handwriting is which yes, Akshata, handwriting is the same which was in YouTube post. So at some places it may be difficult, but I use gel pen after 8 9 GTs. So and so there I think there it will be clear by using gel pen. So I use gel pen only after that. Okay, so at first, when 8 months ago I started to write this book. Then I was not in a mood to publish it or anything like that. I was doing it for myself. Okay, so few time later we will get it typed because now we don't have that much time, and 600 pages is a big deal to get typed. Okay, so now it is like which I have sent the maybe you may understand 70-80% of it, 70% of it. Okay, so that is the case. Okay, then is the sodium iodide importer is present in salivary glands, gastric mucosa, and ciliary body, choroid plexus, and mammary glands. Okay, then next is the fingerprint changes. Fingerprint changes in dermatitis. There is incomplete atrophy of the ridges. Incomplete atrophy. Then there is loss of pattern in celiac disease. Permanent loss of fingerprint occur in the radiation exposure. Permanent loss of fingerprints. Okay, then is there is T half formula. T half is equals to 0.693 upon K. Formulas are asked in INICET. You remember the loading dose formula was asked. Uh, VD into clearance by bioavailability. Okay, so then is the nutmeg liver. Nutmeg liver is dark areas represent the necrosis and white areas represent the viable liver tissue in nutmeg liver. Then attachment and effacement lesion is seen with enteropathogenic E. coli. Then HDI include life expectancy at birth, literacy, and standard of living. Okay, then Bishop score is very important. Favorable Bishop score is more than 6. Okay, so there are points in Bishop score 0, 1, and 2. So dilatation, if dilatation is if means it's closed, os is closed, then 0 point. 1 to 2 centimeter dilated, 1 point. 3 to 4 centimeter dilated, 2 points. Then cervical length, if it is more than 4, then 0 point. Means effacement, cervical effacement is replaced with cervical length in modified Bishop score. So if it is more than 4, 0 point. 2 to 4, 1 point. 1 to 2 means cervical length is decreasing, so it is getting effaced. So 1 to 2 is 2 points. Consistency, firm consistency 0 point, medium 1 point, soft 2 points. Position is posterior midline anterior 0, 1, and 2 point. Okay, if it is anterior, then 2 points. Head station -3, -2, -3 head station 0 point, -2 1 point, and -1 or 0 plus 1, so it's 2 points. So total is 13. Total is 13 and favorable Bishop score is 6 to 13, more than 6. Okay, then is the saphenous vein patch is used during carotid endarterectomies. Okay, then to differentiate between obstructive and testicular cause of azoospermia. To differentiate between obstructive and the testicular cause of azoospermia, do serum FSH levels. Okay, then minimum duration between consumption of phenytoin and sucralfate should be 120 minutes. Okay, so category, we give category to the drugs A, B, C, D, X. What it means? It means that means category A, B, C, D, X is indicative of safety of the drugs in pregnancy. Okay, then chest tube insertion is contraindicated in diaphragmatic hernia. If you are having any doubt, you can ask. Okay, so uh, give me 1 second. Okay, So the next is, so I told about chest tube insertion. Okay, so that is the point that you just keep on revising, but MCQ practice is more important at this phase. Okay, do try to do maximum to maximum MCQs. Okay, so thank you for joining in this session. Okay, last MCQ which I am telling in this session is uh, that chest tube insertion is contraindicated in diaphragmatic hernia. Then is what is the treatments of some bone tumors? Osteosarcoma, wide excision, simple bone cyst, intralesional steroid is given. Giant cell tumor, curettage is done. Then osteoid osteoma, radiofrequency ablation is done. Then is the nerve supply of uvula. Uvula is supplied by ninth and 10th cranial nerve. Now, which component of this endotoxin is responsible for shock? So, lipid A is responsible for endotoxic shock. Okay, then S phase is most radio resistant phase. G2 to M phase is most radio sensitive phase. Okay, so I think that is sufficient for today's doubt session. Okay, so try to ask maximum doubts in the live sessions, and that was all for today. Thank you for joining.